Strange way to get it.
Well, whatever it takes. You thought you were going to be a war hero, didn't you?
There could be worse.
Yeah, exactly. Okay. Okay, so let's get started. Afternoon, everybody. We'll start with the daily tracking numbers. As of today, the Kansas Department of Health and Environment has announced that we now have 3,328 confirmed positive cases of COVID-19. That is up 154 from yesterday. We are actually down one county reporting from 76 to 75. There was one case reported in Scott County, but that was a Coloradan, so we're taking that one off of the county list. Our death rate went up by 2, so we're now at 120 total deaths. I will let Dr. Norman fill you in on the additional details on KDHE's response in just a minute, but before I do, I wanted to provide everybody with an update from our federal partners. On a call with the White House a little earlier this afternoon, the President discussed his plan to reopen the economy, which included a blueprint for testing and rapid response programs. The plan highlighted the partnership and responsibilities of the federal government, the states, the locals, and the private sector. We're in agreement that we do need to work together to prioritize testing. It is the only way that we can safely reopen our economy. As for the needed equipment, yesterday FEMA fulfilled one of our resource requests with the Patel Decontamination Station. The Patel, which is FDA approved, will sterilize N95 masks and make them safe for reuse by the healthcare workers who originally wore them. The system, which will be available for healthcare facilities in the coming weeks, will reduce the shortage of masks by extending their lifespan. Masks that meet certain conditions can be decontaminated up to 20 times through this system, which obviously greatly extends the life of critical PPE equipment. The system will allow us to sanitize and reuse up to 80,000 masks a day, and we plan to run it day and night, expanding capacity all across the state. Staff is currently installing and testing the system, and we anticipate having it fully operational early next week. KDEM and KDHE will work with state and local partners on the system's launch and logistics for its use in healthcare systems across the state. I have been very transparent and forthcoming about my concerns over our ability to secure PPE. While this new system won't fully resolve the shortage, it will go a long way towards protecting our frontline workers. And I would like to thank our federal partners for helping us secure the Patel. Finally, the state has launched a new website, covid.ks.gov. Again, that's covid.ks.gov. With numerous user-friendly features and timely information, the website will offer a centralized place for resources Kansans need as the state responds to and recovers from the damage done by the COVID-19 pandemic. The KDHE site is still up and running and will continue to be updated, but as we start to expand beyond the medical portion of this pandemic, the new site will provide resources to the public beyond just medical information. The site is ADA compliant, mobile optimized, and will be available in Spanish. The site includes information that many of you access on various state websites: KDHE's daily case rates, what to do if you experience COVID-19 symptoms, and how to protect yourself, and more. However, this site will also include updated information on state resources to help Kansans. For example, the Department of Commerce has 2,100 job postings from Kansas companies seeking to fill vacancies right away. We hope this will continue to grow over the coming weeks and months. Kansans can also learn about some of the great volunteer efforts taking place statewide and how they may contribute to those important causes. We all know this is a scary and uncertain time. It's important to celebrate the unwavering and far-reaching kindness Kansans are known for during trying times. The new website will feature many acts of kindness from across the state, like birthday parades the Merriam Police Department organized for kids who can't have traditional birthday parties, or the food pantry a Wichita family placed in their yard with one simple rule: take what you need, leave what you can. Recently, we saw the governor of New York highlight the generosity of one of our Kansans who sent him an N95 mask. This is who we are as people. And seeing the many ways Kansans are helping one another, especially during this difficult time, is truly inspirational. I'm thankful every day for these kind gestures, and we want to do more to celebrate them. And with that, I'm going to turn it over to Secretary of Health and Environment, Dr. Lee Norman.
Thank you, Governor Kelly. Unfortunately, we had a death over the weekend of one of the Lansing Correctional Facility offenders, and he was a man over the age of 50 with significant underlying health conditions. It's always a challenge with an infectious disease like COVID-19 in places where people have restricted movements and are close together, and of course we're saddened by the passing of this inmate. The state currently is monitoring 55 clusters. 18 are in long-term care facilities with 401 cases and 68 deaths. 2 group living arrangements with 28 cases and 0 deaths. 1 correctional facility, as I mentioned to you, had 115 cases, 1 death. 2 healthcare facilities with 16 cases, 0 deaths. 6 religious gatherings with 99 cases and 8 deaths. 20 in private companies with 170 cases and 4 deaths. And 6 in meatpacking facilities with 378 cases, 0 deaths. Contact tracing and testing. We know the state, and as we look towards reopening the state, that the key to this will be testing and contact tracing. Currently, we have 20 existing KDHE staff who are being trained to do contact tracing in Lyon, Ford, Finney, and Seward counties. We will then be bringing in volunteers at approximately 50 in a cohort at a time as we ramp up to what we're targeting for now to be 400 volunteer people to do case tracking. The question came up last time, and I'm answering it this time, about the ingestion of toxic chemicals, including chemical solutions and solvents and the like. And so I talked to my colleague, Dr. Steve Thornton, who's a toxicologist and emergency medicine physician that runs a Kansas Poison Control, and he said that indeed we've seen a bit of an increase with more than a 40% increase in cleaning chemical cases, including a fellow over the weekend who drank a product because of the advice that he'd received. So we're doing what we can to counter message against that kind of remedy. Last point that I have prepared is that, as per what the governor said, at the KDHE website, we have something just turned on about a half hour ago, and I think that the public will find it very interesting, is a map. It's a Tableau, is the name of the application, and has a very interactive map of the state of Kansas with lots more information on it. I wanted to bring that to your attention. Otherwise, that's the end of my prepared comments.
Okay, questions?
Governor, unfortunately, some businesses had to close before the stay-at-home order, and some smaller businesses. Is there anything that can be done to revive those businesses once the order lifts and business can continue?
Well, we need to look at that on a case-by-case basis, but we are hoping that the CARES Act will provide us some resources to be able to assist in a whole host of areas, including in our business area. We're also, I believe it was just this morning, the second round of the Paycheck Protection Act was passed, and so I think there's another $320 billion out there for loan to small businesses. Hopefully this will be more directed and targeted to truly small businesses. Kansas did quite well in the first round of the Paycheck Protection, and I would encourage all businesses for whom that would be useful to go ahead and get those applications in ASAP if they haven't already done it.
Governor, is it a problem that Colorado has joined this western group of states in this planning with them? How does that affect your own attempts to collaborate with Missouri and Colorado?
Well, I think Colorado is, much like Kansas in that it's got, it's the west, Denver and west, and then it's got its eastern portion, which is really much more like western Kansas. So I think we'll continue to work with the state of Colorado focused on that particular region.
And have you spoken with Governor Parson?
I spoke with Governor Parson last week, I believe. But I know that he is having a press conference this afternoon, I believe, in fact, just a few minutes. And I asked my chief of staff to see if he could get a copy of the rollout, because apparently Missouri is doing their rollout, how they're phasing back in their economy this afternoon. So I don't know if we've gotten that yet, but I'll be looking for it.
But you're still going to collaborate?
Yeah.
Can you take us into where you are at in unveiling your reopening plan? Obviously, some Republican legislators said they would like to see that sooner rather than later. When should we expect it this week?
Well, all 74 of those legislators had the opportunity to be on a weekly call with me, and where we talk about exactly those kinds of things. They also have had access directly to our government affairs folks, so if they had questions or concerns or wanted to provide input, that resource has been available to them for quite some time. So they're fully aware that we have been working on the recovery plan, and that we plan to announce that this week. We're continuing to sort of dot the I's and cross the T's. We have had numerous phone calls with all sorts of industry sectors to get their input, so that what we put out there, in addition to working with our neighboring states, we've been working within the state with our own industries, our public health partners. Just got off the phone this morning with our safety net clinics. We're working with everybody in the state of Kansas that we possibly can, so that when we put these out, they will have provided us input, but they'll also know what to anticipate and can work accordingly. So, we've said we will announce that on Thursday afternoon, but that doesn't mean we haven't been having lots and lots of conversations, including with legislators, prior to that time.
Governor, can you mentioned the unfortunate death of Lansing. Can you address, is the prison safely staffed, given the sheer number of staff members who are either in quarantine or have contracted the virus? Are you confident that the prison has been able to maintain safe staffing levels?
Well, Jonathan, we have had staffing issues for a decade in our prison system, and that continues. The one thing that we have going for us at Lansing is that new facility that was built and is being occupied at this point, and that does, because of the layout and configuration, does reduce staffing requirements. So it doesn't eliminate the shortage, but it certainly reduces the problem.
Secretary Norman, can you, and maybe a little bit for the governor too, when it comes to the number of cases and everything, and testing, I suppose, what must we see this week leading, maybe May 4th is a reopening date, that would make you be confident to tell Governor Kelly it's fine to start to reopen?
Yeah, great question. What numbers will we use as kind of harbingers of things to come? Certainly the number of hospitalizations, which is continuing to go down, and the number of deaths per capita, and the number of deaths per positive case numbers are going down, which are both encouraging. We will, without question, continue to see an uptick in the total number of cases as we do more testing. And that's going to be a challenge to how to communicate that to people, because it looks like things are getting worse in the case count, but it's not in reality. And a great example was what I mentioned down in the meatpacking plants, 378 people, infected patients so far, no deaths, and to my knowledge, no hospitalizations. There may be a hospitalized person in Seward County. I'm going to try to confirm that. And in talking with the physicians there, they're seeing most of these people are either asymptomatic or minimally symptomatic. So it takes, you have to read beyond just the numbers, but to see what the trend lines are. And I think that what we'll see is a peaking out of the case count in terms of the number of positives compared to the number of negatives, and it'll turn the corner and drop. But the fact that hospitalizations and deaths are going down is, and the overall influenza-like illness measures that we already are measuring around the state, because COVID-19 is certainly one of those. It's dropping like a rock.
So even if numbers are at least staying steady or even going up, you could say it's fine.
Yeah.
Governor, given that there are hotspots of case numbers in certain parts of the state, would you be looking at potentially reopening some parts of the state while keeping an executive order in place for others?
Well, the way we're going to deal with that is when we lift the statewide stay-at-home order, we then reauthorize the local counties to take our guidelines and be more restrictive if they think it's warranted in their particular environment. So that responsibility will go back to the counties, and that authority actually will go back to the counties to put in measures that are more restrictive than we have statewide. If we see a need that's not being addressed on a local level, Secretary Norman does have the authority to override what's being done in the local county. We haven't had to use that. We haven't wanted to use that, but that does exist. But we've been in very good contact with our local public health officials and emergency management folks over time, and I'm confident that our counties or our public health officials are keeping a close eye on what's going on in their communities, and that as we lift up the statewide, they will superimpose other restrictions if they feel that that's necessary to protect their folks.
Governor, how do you square the frustrations that you've shared repeatedly over testing with the assertions made in the joint motion over the weekend that you are, barring some significant development, that you are planning to ease restrictions beginning on May 4th?
Well, I think you've heard Dr. Norman now several times talk about the metrics that we'll be looking at to determine if it's safe to do that. And right now, I think we're determining that it is, that the trends are such that we're comfortable with that. We also have made some progress on the acquisition of testing, and that's helping us wrap up our testing capabilities much more robust than it's been before. And I think we also have talked at some point where, 80% of our testing, is done in private labs, and we did not have a mandate for them to report the negatives. So there was a lot more testing going on than was reported. So I think we're getting better numbers now, and we're much more comfortable.
Has the CDC promised you roughly 25,000 test kits? That's what the New York Times had reported over the weekend?
I think it was, that would have been one shipment?
Mm-hmm.
Yeah, that would have been one shipment.
Governor, given that in meatpacking plants there are a lot of people working close to each other, should the state have foreseen that there would be problems with clusters of COVID-19 in meatpacking plants and demanded steps in advance with wearing masks or other steps?
Well, actually, I would tell you that the companies themselves anticipated some of this and actually put in to their production procedures safety precautions, and we got some of that information from some of the companies beforehand, and then had conversations with them. So we were working offline before these spikes happened, but we were cognizant that was a potential hotspot. And then it became very obvious in Iowa and South Dakota and some other states. So we had taken some proactive steps, I think, on that level. And I just talked with a gentleman who represents a lot of meat packers to find out if indeed the companies were using those guidelines. Had they put the plexiglass up? Had they provided the PPE? Had they spaced out the workers? And he spent a couple of days down in southwest Kansas last week, and he'll be back this week. And he was comfortable that they were adhering to the safety guidelines.
There are obviously still some people that want to reopen immediately. Why wait a week?
Why wait a week until more liberal people movement and that kind of thing? Is that what you're asking?
Yeah, the reopening the state, let the stay-at-home order dissolve.
Well, the governor will speak for herself, obviously. What I think is that I I think you have to walk before you can run, and there's still a lot of COVID-19 out there. And I think that it would be imprudent to make that big of a leap without taking a more measured approach. And really, in answer to two of your earlier questions, one of the things I forgot to mention is one of the criteria is, do we have the ability in the state of Kansas to test everybody who's symptomatic? I didn't address that, and the answer to that is yes. In our current run rate, we have the ability to test everybody who is symptomatic in terms of the testing capacity.
I think there are other things that you look at when you're timing something like reopening the economy, even in phases, and that is that you have had in-depth discussions with all the stakeholders in this and allowed them to provide some input, because this impacts a lot of people one way or the other. Whether you're talking about our business, you're talking about our local elected officials or public health officials, there are a lot of people who will be impacted about how we do this lifting of the stay-at-home order and how we phase recovery and reopening of the economy. So we just wanted to, if we were going to do it, we wanted to do it right. And we also, at the time that we made the decision to extend the stay-home order to May 3rd, we had the sense from a lot of what Dr. Norman and others were telling us that would likely be, after the peak and as we're starting to come down. So in some ways we got lucky that the timings all seemed to work out, but it also did allow us time to have really in-depth discussions with a lot of folks who will be impacted by our decision.
Secretary, how long do you think it should be that we practice social distancing? Do you think that could last until the end of the year, maybe?
Yes, I think the question is about social distancing. I think we're going to actually fundamentally change how we interact in businesses and in groups of people. I think there's going to be a long-term impact. For example, went to a laboratory today and met in a properly spaced big table with people, and the fact that it's no handshakes and how you hold on to doorknobs and how you, on a tour, for example, of a lab, distance yourself. It's just a fundamental change, and I wouldn't be surprised to see the social distancing toward the end of the year.
Well, I've heard several counties discussing when or if opening pools back up. Is that the sort of situations that you guys will be working with them on?
We're waiting for the CDC to come forth with a recommendation about pools.
Yeah. I actually did see something today in the paper about pools being opened Labor Day weekend, or Memorial Day weekend rather. That is the customary weekend for pools to open. I did have a conversation with the executive director for the Kansas Recreation and Park Association, a job I used to hold for about 18 years. And we talked about this because that is another industry that we thought important for them to have input on how this all worked out. So we had discussions, whether they'll actually be able to open those pools on May 29th. I think it'll be close. Hopefully close and safe. If all things work out the way we are hoping they work out, and we can continue to move through phases, I think that or very close to that date is reasonable.
Governor, you've had during this crisis a eviction moratorium, if you will. I am wondering if when you face a wave of evictions once these restrictions begin to ease and once your order expires, and can you take any steps to kind of blunt that or curtail that at all?
Well, we're having those discussions right now. A lot of our executive orders are expiring this week, and so we're taking a look at all of those, and we will deal with that one specifically. I don't think it's in anybody's best interests, whether you're the evictee or the evictor. Remember, that just gives them an empty space. So we'll look at what we do executive order-wise, but I think also I'm hoping that Kansans will continue to be Kansans, and that they'll be looking out for one another and won't take advantage of this situation and be punitive.
Governor, when do you plan on releasing the small number of inmates that you mentioned last week?
I think we will have an answer on that by midweek this week. I think that list has been compiled. It's just, I wish it were just as easy as sort of opening up the door, and letting folks out, but it's not. It's very complicated, both legally and then personally for those folks and their families and whatnot. So it just takes a lot longer than we had hoped for it to take. But I think sometime this week for sure.
One more question?
Congressman Estes over the weekend in a column had expressed his opinion that the states should not be receiving what he called bailouts to help them with their fiscal mess or problem, whatever you want to call it. I'm curious, how supportive are you finding Kansas's federal delegation in terms of openness to providing aid to help with the revenue shortfall that the state faces?
Well, I think, Jonathan, that right now there's a whole lot of politicking going on in D.C. and a lot of posturing and whatnot. I think in the end that the Kansas congressional delegation will be there for us, but I don't think the timing is right now to ask them to come out and express their support for that. We just need to let some things play out in D.C.
Thank you.
What was the disposition of the man who ingested the disinfectant?
I have not heard the specifics. Usually if it's alcohol like Clorox or something like that, it usually causes severe esophageal burns, but I have not heard anything about this.
I really wonder if you can find like social distance.